Welcome to Pelvic Health Academy with Dr. Logan Lynch. My name is Logan. I'm a doctor of physical therapy and I specialize in pelvic health. So I treat mostly women, but I do treat men as well, but mostly women who struggle with different diagnoses like stress incontinence, otherwise known as bladder leakage, with things like coughing, sneezing, laughing, other types of incontinence, prolapse, constipation, postpartum, just return to fitness, pain with intimacy, lots of different things. But one of the most common that we hear online or that I see in my office is bladder leakage, specifically with what is called stress incontinence. And there are different types of incontinence. Incontinence is just the involuntary release of leakage, but there are different reasons why that can happen. There is functional incontinence, which typically happens in an older or less mobile population where they just physically cannot get there in time because of a mobility issue, lack of, strength to get up from a chair, things like that. There is urge incontinence where you really have to go to the bathroom and you don't get there in time. And then something like stress incontinence, which comes from intra-abdominal pressure. So what I want to break down today is what is actually happening when it comes to bladder leakage. What actually is going on that is causing this bladder leakage, and give some suggestions of kind of where we start to help alleviate symptoms, and then where pelvic rehab can come in to help resolve these and not be so cautious about it. So what I'm going to draw here to get started to explain what is going on is your intra-abdominal pressure system. So when we think about your core, right, we a lot of times only think about the abdominals, but that's only one piece of it. So we have our diaphragm on the top here. This is a dome-like muscle that sits inside of your rib cage and it moves when we breathe. Opposite of that on the bottom is our pelvic floor. So we're going to have that as a bowl, because that is kind of how those pelvic floor muscles sit in this kind of bowl-like structure within your pelvis. Then we have your abdominals. So we're going to consider this the front side. So these are your abs, your pelvic floor, your diaphragm. I'm just going to do that, and then your back muscles. Okay. So this is the front of your body. This is the back of your body. This is your pelvic floor. And inside of here is where the pressure comes in when we breathe, when we cough, when we sneeze. So when we are just breathing in and out, when we breathe in, this diaphragm drops down, and at the same time, your pelvic floor goes down. We have this downward movement, and your abdominals should go out, and your low back muscles should be able to expand as well. This also kind of includes your rib cage going laterally. So your rib cage would come out this way. When we exhale, the opposite happens, and so everything comes back up. Abs come back in, these release, diaphragm comes up. So basically, as we breathe in and out, there's no real pressure change because the air is flowing and things are moving. So if we think of this as like a pop can, we're not adding pressure without expanding. We're bringing that air in, which will increase pressure, but because we expand, it kind of stays the same. And then when we exhale, everything goes and pushes that back out. So we are able to manage that with the structure of how these things work. When it comes to bladder leakage, we have this basically, instead of keeping the pressure nice and spread out in the system, this pressure, so we'll say pressure here, is being directed downwards, okay? So this pressure coming down on the pelvic floor, right? Because this is where we're having the leakage happen. There are other pressure issues like hernias, hemorrhoids, where that pressure might be directed somewhere else. So for a hernia, that pressure is being directed more out towards that groin area, the low belly button line. So that can happen if pressure is being pushed out that way. For things like hemorrhoids, still pelvic floor, but maybe more directing at the back, so at that anal sphincter. So we're going to think about the pressure coming straight down, and we have our bladder in here, and then obviously the urethra that's coming down. So these are the muscles, your pelvic floor are the muscles that keep everything in. So what is happening when they're not doing their job? Well, we have different layers of the pelvic floor muscles. So we have this deep layer that gives support to the organs themselves. So we have the deeper layer that is giving support to the bladder to combat or to support the pressure coming down on it. So when the bladder gets pushed on the top, we have this deeper layer of pelvic floor muscles that are helping match that so that it's not moving the bladder too much, it's not excessive pressure, and you can handle it. Then we have more of a superficial layer that is closing or keeps sphincters, or I'll just say holes, closed. Okay, so we have, we'll say this is the superficial layer, right? That closes where your urethra comes out. We have muscles there that close that. So when we're having leakage come out, the pressure is exceeding what these muscles can handle. And there are different reasons why that can happen. So the pressure, the amount of pressure is higher than what these muscles are able to keep in. And thus we have urine come out. And again, this often happens even if you just went to the bathroom. So a lot of people try to go empty their bladder so it doesn't happen. Maybe you make it less likely if your bladder's not as full, but that's not always the issue. It's not the urine that's in there, it's the pressure. And so even if we, especially if we don't get everything out when we went to the bathroom because those muscles are tight or something like that, then we're still gonna have a little bit stuck in that urethra or in the bladder that can get pushed out. So we need to figure out, why is this pressure exceeding what those pelvic floor muscles can handle? And there are a couple different reasons that come up, and that kind of guides where we start to treat. One is we are creating too much pressure, okay? So we are holding our breath, or like lifting way more weight than what our bodies may be ready for or trained for. So there's an excessive amount of pressure that our system is not used to and is not ready for. These pelvic floor muscles, those abs, are not trained to handle that pressure. So maybe, you know, we're freshly postpartum and we're trying to lift heavy weight again, but those muscles just got really, really stretched out. And so your whole system is less connected, less stable, so it can't manage that pressure as well. When we sneeze, when we cough, when we hold our breath, all of those increase pressure. So it's gonna make it a little bit harder to manage within here. So what we can do to reduce pressure in certain situations is, one, breathe. Exhale through your lifts. Exhale through your heavier, more effortful movements to reduce the amount of pressure. If we're sending that air out, we are reducing the amount of pressure that we are asking those pelvic floor muscles to handle. Obviously, that's not always doable because we have sneezing, coughing, where it's like it naturally holds and we're not breathing while we do those things. So, but especially in activities where you feel those symptoms happening, like jumping, lifting, picking your kid up off the ground, putting something overhead, like those types of things, getting up, for a sit-up, breathing, exhaling through those movements can be helpful to reduce the pressure and giving those pelvic floor muscles a better chance to hold everything in. Now, the other areas is what's wrong at the pelvic floor, okay? So let's say we have sneezing and coughing. That's a standard amount of pressure pretty much every time. So we want to know, okay, why are these muscles not holding everything in? Then we think about the health of those muscles. Are they flexible and are they strong? Okay, so let's talk about flexible first. When we think about these pelvic floor muscles, we want them to function sort of like a trampoline. Got my trampoline down here. We want them to be able to kind of flex with us, but then also contract back up. We want them to be able to react to forces and pressure. So they cannot be too tight. So the first side of things is if these muscles are too tight and that pressure is coming down on them, there's no way, there's no give in the system. There's no flexibility to absorb that pressure. So the pressure is going to exceed what those muscles have the strength to hold in. Not because they're technically weak, but because they're so tight and contracted, there's no room for them to contract. There's no reaction. There's no ability to hold things in because they're so rigid. So they're not flexible. There's no trampoline effect. It's like a brick wall. And so that pressure is going to feel very excessive, and those muscles have no response because they're already in such a tight space. Other symptoms of this is like if you have to pee a lot, you feel like that urgency comes up a lot, or you don't feel like you completely empty your bladder, or you have any sort of pelvic pain or pain with any insertion like tampon or intimacy. Those are signs that likely there's no flexibility in those pelvic floor muscles. And we have to address that so that they're able to catch that pressure and react to close off and close those sphincters. On the other side of things, we could have muscles that are not providing enough support. So they're too weak, too lengthened. We never got that connection back. And their ability to handle that pressure, right? The amount of pressure is exceeding the strength of those muscles or the coordination of those muscles. So we have more of this, okay, they're kind of like weak and sitting low. And so that's a long way to go quickly to contract back up and manage that pressure that's coming down. So the speed of it, the reaction of it, the coordination of it, in addition to just, can those muscles do a contraction? Can they do a Kegel? And that can be the issue. So now we're not closing those sphincters in time or fast enough, or we don't have the strength to get all the way from a very stretched position all the way back up to a contracted position with something like that when all that pressure is coming down. So the amount of pressure can exceed what those muscles can handle, but there's different reasons why those muscles are not handling that. And it is not always a true like weakness, strength issue. Sometimes it is a flexibility issue. So in those cases, we want to think about the pelvic floor. We want to think about your hip muscles. Are they tight? What's our glute strength like? What's our just lower body strength? What's our abdominal strength like? How is this all working together? As you can see, obviously it's gotten quite messy at this point, but it is a system. It is not just the pelvic floor's fault. It is not just the abdominal's fault. It is not just, the bladder's fault. It is a system of everything working together. And so what we have to do in rehab is figure out what pieces of this system are at fault or are not working optimally and efficiently, and how do we use exercises, mobility, education, behavioral changes, manual therapy to help retrain this system and get them all working together. So these muscles have the flexibility to absorb force, they have the reaction time and coordination to contract against force, and we have good breathing mechanics and strategies to reduce the amount of pressure that is being directed downwards. We want to keep that pressure in the center so we have all of these pieces to support and we're not putting it all on the pelvic floor. So those are the pieces that we want to think about and why bladder leakage can happen in stress incontinence situations. Again, this is sneezing, coughing, jumping, lifting, those types of things where it's the pressure, intra-abdominal pressure increases, and for some reason the system cannot manage it well, so it's going to the weakest spot. So I hope that was helpful. To break down and just give you some more education about like what the heck is going on, why this is happening, and also open your mind to beyond just that Kegels are the fix or that you have a weak pelvic floor. There's much more involved, and that is where pelvic floor physical therapists or occupational therapists, but therapists that are trained in pelvic floor therapy can help do a full body assessment, because again, there's multiple pieces we want to look at and figure out what we need to address, what we need to retrain and think about to get this system working well together so you can keep things in when you want to keep them in. Again, my name is Dr. Logan Lynch, pelvic floor physical therapist. And if you enjoyed this video and want to learn more, make sure you subscribe to my channel and follow me at doclogan.dpt on Instagram. Lots of free content, lots of exercise ideas. And if you have any questions, then go ahead and comment them down below so I know what to create for you next.